Difference between Asperger's and autism. You may hear a lot of people mentioning Asperger's syndrome in the same breath as autism spectrum disorder. Asperger's was once considered different from ASD, but the diagnosis of Asperger's no longer exists. The signs and symptoms that were once part of an Asperger's diagnosis now fall under ASD. There are historical differences between the term Asperger's and what's considered autism, but it's worth getting into what exactly Asperger's is and why it's now considered a part of ASD. Keep watching to learn more about each of these disorders. Asperger's versus autism. What are the differences? Asperger's and autism are no longer considered separate diagnoses. People who may have previously received an Asperger's diagnosis instead now receive an autism diagnosis. But many people who were diagnosed with Asperger's before the diagnostic criteria changed in 2013 are still perceived as having Asperger's. And many people also consider Asperger's as part of their identity. This is especially considering the stigma that still surrounds autism diagnosis in many communities around the world. Yet the only real difference between the two diagnoses is that people with Asperger's may be considered as having an easier time passing as neurotypical with only mild signs and symptoms that may resemble those of autism. Do treatment options differ for Asperger's and autism? Neither what was previously diagnosed as Asperger's nor autism is a medical condition that needs to be treated. Those diagnosed with autism are considered neurodivergent. Autistic behaviors are not considered what's socially typical, but that doesn't mean that autism indicates there's anything wrong with you. What's most important is that you or someone in your life who's been diagnosed with autism know that they are loved, accepted, and supported by the people around them. Not everyone in the autism community agrees that autistic people don't need medical treatment. There's an ongoing debate between those who see autism as a disability that needs medical treatment and those who see autism treatment as the form of securing disability rights like fair employment practices and healthcare coverage. Here are some treatment options for Asperger's trusted source if you believe you or a loved one needs treatment for behaviors traditionally considered part of an Asperger's diagnosis. Psychological therapy, such as cognitive behavioral therapy, CBT, medications for anxiety or obsessive compulsive disorder, OCD, speech or language therapy, dietary modification or supplements, complementary treatment options such as massage therapy.